How you guys doing? My name is Dr. Ben Chamoyle, the LA chiropractor here in Century City. I'm here with one of our patients, Nick. How are you doing today?
Very good. Very
You
good.
came in from explaining about how you ended up in our office.
Yeah, I got into a car accident about like 2 months ago, and I just was searching up Yelp around chiropractors near my office, and Dr. Ben was one of the highest rated, so I decided to check it out.
Awesome. How's your experience been in our office?
So far, so good.
Everybody treating you well?
Yeah.
Is the doctor okay?
Doctor, he's alright. He's
All
okay.
right, great. Well, definitely had a whiplash injury. We're working on correcting that right now. What I'm going to show you is the high-low table, why we use it. You know, a lot of times patients either have a hard time getting on the table, or they'll get on the table really funny and distort their body. So we use this high-low table to keep the patient very symmetrical on their way down, so they're not sitting and then rolling and all of this stuff, which gives me a false reading when I'm doing my biofeedback. So in a minute here, you're going to see us check Nick on the table, and then we're going to do the cervical adjustment in the chair. Everybody's been asking about how I work on the cervicals and how we clear out the atlas and axis on there. But for the lower part of the spine, we're going to check this out right here on the table. So just, I'm going to bring this up. Let me have you stand in front of that. I'm going to have you actually facing the other way. We'll put this down first. All right. So this is our Zenith High-Low. This table was actually built either in the 50s or 60s. It's been reupholstered several times. It's a working horse, and it really delivers on everything here. So one of the things I want to make sure, and what it does, is it keeps the patient's hip and body in balance. So when we're doing the adjustment, we're getting exactly what we need to see. So we're using this for the Thompson drop technique. Saves my back and saves the patient. We can do our leg checks to see exactly a short leg. Nick also just let me know this weekend that he had a fall. He fell backwards into some bushes. He's okay, but he did have a fall, which is stress onto the system. No matter how minimal it is, it's going to affect the neurological system. It's going to send him into his body into a reactive mode. And most people don't get that checked out. So long periods of time, you have multiple of these effects. It'll start to wear and tear on your body. So we did a leg check. We can see that there's a pelvic issue going on this side. I'm going to have him do a cervical study. So we're going to have him turn your head to the left for me. Turn your head to the right for me. And back to the middle. Okay, let's get a clean one. Not that our floors are dirty, but let's get a clean one. Okay. I like the drops because it allows me to make the correction without the patient guarding. Okay, so it's very easy when you feel the patient's spine. It's very nice and comfortable. Nobody's in a state of tension. And I also like to use the blocks. I mix some techniques. This is how I've kind of created my own. I'm going to lift up here, bring it down for me. This is going to open up this joint here. And we're going to make a nice couple of nice even drops. 1, 2, 3. Now, well, if that wasn't a lot of force, Doc, you didn't have to do it. Yes, because the patient is not tight. You can feel total relaxed, right, Nick? He's not guarding, he's not protecting, and sometimes when you get a patient into a side posture or roll, they're holding their breath, they're guarding. You could actually injure yourself as a doctor. Shoulder happens to me when I was in my earlier years of practice. So now, using the drop table, nice, easy drops. There's no guarding, so the joints just glide right into place. We're going to go right into L4, L5 on the opposite side of the pelvis. drops there. Gonna go back and see how that affected his pelvic spine. Boom. That cleared out his spine. So we're doing a pre-check to see how his pelvis is doing, which is a pre-orthopedic check, and we're doing a post-orthopedic check. So the pelvis is clear. Squeeze your knees together for me. Right, safe position. Now I'm going to check his cervicals. Now that we've cleared that out, let me have you turn your head to the left for me. All right, there we are. We're going to go check. Tell me which one's the most tender. 1, 2, 3, 4, 5. 4, 5. Back to the middle for me. Okay, so C4, C5 posterior, I like to use the drops on this. Whether it's Thompson or the Pierce technique, C5 posterior. And again, a lot of people don't like to have that cervical rotation. Most part, they don't want to hear those audibles. Very, the neck adjustment might stress them out. So this is another way to approach that. Now, some patients love that, and they won't leave until you've moved every vertebra in their cervical spine. Some patients are the other way. I like to adapt to both. And so coming in here, nice easy drop. Then come right on the spinous process, and we are, relax your shoulders for me, just driving that C5 through. Okay, now I don't notice a lot of rotations in the spine, it's more posterior, so it's going posterior, and we want to move that forward. Got one more. Again, nice easy drop. You don't need to recoil this. This just goes in right there. All done. I'll check the rest of the spine. Great. Now I'm going to adjust his upper cervical in the chair. We'll have that video for you in a second. But pretty much we've cleared out everything that needs to be on the table. Again, this is way faster than what we're usually doing it on the camera. Once we do this, this all takes about 90 seconds for analyzing, detection, and the correction of the vertebral subluxation, and removing that stress so his body's functioning at a higher level and performing at a higher level. Thanks for joining me on this session. We'll catch you in a few minutes on the chair, and we'll go from there. Thank you. Hello again. Thanks for joining me. Dr. Ben Chameau, the LA chiropractor here in Century City. I'm with our patient Nick. Auto accident. Some of you might have just seen the other video about how we adjusted the rest of his spine using the Thompson technique on the high-low. Now we have analyzed this. We've noticed that on this right side we have several subluxations coming from, feel that one there, Nick? Yeah, right up there, C1, just blasting out one side. And so what we're going to do, we're going to set that really clear. I like this adjustment on patients rather than the supine rotary, because they seem to be more relaxed in this position. So I'm just going to have, Nick, if I could have you scooch down for me just a bit. I'm going to start with the lower cervical right here, and we're just going to move that laterally, nice gentle flexion, and one more coming up on this side, really tight, relax your neck, good. One more on this side for me, relax all the way up. All right. How is that one?
Better than before.
Better than before.
Yeah.
You know, again, every visit builds on the next. Been a motor vehicle accident and then had a fall this weekend. Might have been minimal to him, but it's that little thing that adds more stress to something that we're already creating. So we had the cervical spine move, open that up. We did the rest of the spine on the adjusting table, the high-low. So that's what we want. You can sit up for me. That's what we want to see. Real nice and easy, smooth move. Great. We're going to check Nick again in 2 days, make sure everything is holding and improving on his trauma that he had in a motor vehicle accident. If you've been in a motor vehicle accident, don't wait. Aren't you happy you got this checked rather than waiting?
It was pretty tight and tense at work.
It was giving him more tension, more stress at work, taking his focus away from what he needed to be doing, and now we're giving him his quality of life back. So I want to thank you for joining us. You can subscribe. The LA Chiropractor here in Century City. Have a terrific day. Thank you.